Perfect. So I'd like to acknowledge the traditional custodians of the land of which we are currently on across the country and pay respects to elders past, present, and emerging. On behalf of Heart Support Australia, thank you very much for attending our Heart Support Connect series, which we do in partnership with Solve CHD from the University of Sydney. We have Dr. Ritu Trivedi with us tonight on a really cool and interesting topic called or titled The Importance of Blood Pressure Management for Heart Disease. She comes with a wealth of experience in this area. And we are very thankful to have her here tonight with us. Just double checking, Rita, you can actually see the screen that we're sharing with your image on it. Is that correct?
I can see that, yes.
Yep, perfect. So, just for some context, before I hand you over to Ritu to go from there, her background, she's a postdoctoral fellow. I'll just have the information here. Postdoctoral fellow at the School of Health Sciences. She recently completed her PhD in September 2024, which focused on digital health um, technologies for supporting patients with atrial fibrillation. She was awarded a highly competitive Commonwealth Government Research Training Program stipend scholarship, as well as an industry scholarship from Digital Health Cooperative Research Centre to support her doctoral studies. Her postdoctoral research work is focused on the accuracy of devices used by Australians to measure their blood pressure at home. Ritu's research interests are in optimizing self-management for those with cardiovascular conditions. And on behalf of Heart Support Australia, I'd like to welcome her here tonight on something that's really important because as patients, most of you, and some healthcare professionals on the phone, people are always looking at what they can do at home and to manage their own health and manage their heart disease. So I will hand it over now to Ritu to continue on with her presentation. Here you go. I'll make you now most perfect. All over to
Okay,
you, Ritu. Thank you very much.
thank you. I'm just going to figure out how I can share my screen. One second.
Should be at the bottom on the green button, I reckon.
Yeah. Okay. Share. I might just swap this. There we go. Okay, so great. I think where everyone can see my screen, okay? Yep, great. All right. So thank you so much for the introduction and giving me the opportunity to present. And all of you online, thanks for taking out your time on a Tuesday evening to be here. So as mentioned, I'm going to be talking about the importance of blood pressure management for heart disease. Now, it's quite a broad topic, and there's a lot of things that we could discuss, but I'm going to focus on a couple of things and also include some research that's been done as well. There may be stuff here that you already know, but I hope sort of at the end of today, maybe you learn something new. So let's start from what actually is blood pressure. So we know that the heart pumps blood around the body through blood vessels, and these are called arteries. Blood pressure is a pressure or the force of blood pushing against the wall of these arteries. Now, you can imagine that the heart is contracting when it does this. I think I'm getting a notification. Christian, is that to let someone in the meeting?
Most likely, so you can admit them seeing your host now if that's okay. Just on the side, that's fine. Thank you.
Okay, sorry, I'm gonna have to, I might just give me a second to, oh, I think it's gone now. Okay. So now when you imagine the heart contracting, what it does is the pressure in your arteries rise. And when it relaxes between the pumps or the beats, the pressure on your artery wall would decrease. And so when you see a blood pressure being reported, it's usually two numbers. For example, something like 118 over 78. The first number is the systolic blood pressure. So it's a pressure at the peak of the graph, and it represents your heart contracting. And the second is a diastolic, which is when it relaxes. So now some people can sort of fixate on these numbers, but it's natural for them to go up and down depending on what you've been doing. So if you're exercising or you're stressed, it could go up. But if you've had a nap, it might go down. But I guess things become problematic when it's consistently high or low. So what do we mean when we say someone has high blood pressure and or hypertension? And what we mean is when someone's blood pressure is usually above 140 over 90 at the doctor's office or above 135 over 85 at home. That's when we'll say they have high blood pressure. And so ideally, we want the blood pressure to be within the normal range. And this is because the higher the blood pressure is, the higher the risk of stroke, heart attack, heart failure, dementia, kidney disease, all of that also increases. But the most important thing is that even people with high blood pressure, we have ways to lower it and we can reduce this risk. And there are two sort of main ways that guidelines recommend that we can lower blood pressure, and it's through medications, but also healthy lifestyle changes. So things like weight management, not smoking, limiting alcohol, good mental health, being physically active, and having a good diet. Um, and these things are sort of very important. And your healthcare provider, they might recommend a combination of healthy lifestyle changes as well as medications to keep your blood pressure within that healthy range that we want to see. And so, as I mentioned before, if you lower your blood pressure, you then lower the chances of these other health conditions. Okay, so here's a question. How common do you think high blood pressure is in Australia? You can type your answers into the chat, A, B, C, or D. What do we think? Yeah, so someone we've got A, maybe a C, D, C. Okay, so close. Um, it's actually, it should show up. It's D. So about, uh, 1 second. It's about 25%. So one in every four Australian adults. Um, so it's quite a large number there. Okay. I briefly mentioned the link between high blood pressure and cardiovascular disease on a previous slide, but just to recap, having high blood pressure increases the risk of developing cardiovascular disease. And we know that cardiovascular disease is the number one cause of death and disability, but high blood pressure is something that we can prevent and we can stop this progression from happening. And so, therefore, reducing the deaths and the disability caused by the cardiovascular disease. So, we're fortunate in Australia that we have access to really good medications that are very effective when taken properly and are quite affordable and accessible to people. But we still have a problem with blood pressure control. And what I mean by control is that how many people are sort of within that normal range that we want to see. And only 32% of Australian adults are within this normal blood pressure range. What we actually see is that a lot of almost half of the people are unaware that they have blood pressure. And even those that are aware, a lot of them are still not controlled. And those that are treated and controlled, we see sort of only that 32% really within that normal range. And we really need these values to increase. So I want to shift gears slightly to present some research that we've done looking at the blood pressure control in patients with atrial fibrillation. And first of all, so I know there's been a webinar on AF, but atrial fibrillation is a irregular heart rhythm condition. It's very common. About 500,000 of Australians have it, and this number is actually expected to double in the next couple of decades. The main thing about atrial fibrillation is to really decrease the risk of stroke associated with it. And this is again possible through a variety of different available treatments that could include medications and procedures, but also lifestyle changes. But what we see is many people, almost 4 in every 5th person with AF also has high blood pressure. And in these people that have both, the risk of stroke is exacerbated. So really lowering blood pressure to achieve that optimal level becomes even more important. But again, want to reiterate that it's not all doom and gloom. There's ways to manage this and to lower the blood pressure. So I want to present some research that we did where we looked at the blood pressure control in these patients with atrial fibrillation within Australia. It's a project that I worked on during my PhD, and it was really first of its kind in Australia to shed light on what the blood pressure management was like in this patient population with atrial fibrillation. And so what we found was that people with AF and diagnosed high blood pressure, more than 1/3 did not have adequate blood pressure control, which is quite concerning given the risks that I mentioned previously. So when we looked deeper into the data, what we found was that women and those that were older than 75 years or older were more likely not to have their blood pressure controlled. But what we found was that those that visited their GP more and those that went to the same clinician, the same GP, well, they had better odds of achieving blood pressure control, which was very interesting. And then a similar story, those that visited their GP more and those that went to the same GP, they also had better odds of being on guideline recommended antihypertensive therapy. So essentially the medications for blood pressure. And so all in all, we found that from this analysis, there's still a problem of poor blood pressure control in these patients with AF. And that's a bit concerning given the high stroke risk. But interestingly, we found that, if those that went to their GP more, they were more likely to have controlled blood pressure and were also more likely to have prescription of guideline recommended medications. And then the same story with if they went to see the same doctor every time, they were more likely to have it controlled and also be prescribed the correct medications for their high blood pressure. So now we've spoken quite a bit about what blood pressure is, why it's a problem, and why we really need to lower it. And I've also showed you some data to sort of highlight in a specific patient population, those with atrial fibrillation, that the control is not very good, and we need to improve that. But it's all well to say, let's control it, let's lower our blood pressure, but how do we actually measure it? How do we know what our blood pressure actually is? And so, when you measure blood pressure, it's more than just doing it frequently. It's also doing it properly that makes a big difference. So blood pressure can be measured by a doctor, it can be measured by a nurse, it can be measured at the pharmacist or even at home. What you need to measure it, you need a validated device, and I'll go into more detail about what that is. and a correct cuff size as well. And again, I'll go into more detail about that particular bit. But you also need to follow proper steps to measuring blood pressure. So first, what are the correct ways of measuring blood pressure? So first, you need to make sure there's been no smoking, food, or exercise done 30 minutes before a measurement is taken. Second, you need to make sure it's done in a quiet room at a comfortable temperature. And you need to wait or rest for 5 minutes before any measurements are taken. No talking during or between the measurements. And other things that are important for the setup are having your back supported. So, for instance, sitting on a chair with a back part, as well as having your feet flat on the floor. Making sure that the arm is resting at heart level, and this can be done by placing it on a table when you're measuring your blood pressure. Making sure that the cuff is placed on a bare arm, so the cuff is in contact with the bare skin. And again, making sure that you have the correct cuff size for the patient, and also using a validated device for measuring the blood pressure. Now, in terms of how many measurements need to be taken, and this is more for a clinical setting, it's recommended that when you go in to have your blood pressure measurement, that at least 3 measurements are taken at a 1 minute interval between each one. And then the last 2 measurements are averaged. So now there's a few additional things that go into measuring a blood pressure at home that are important to remember. Now, some of you might have been recommended by your doctors to do home blood pressure monitoring. But there's some additional things to consider apart from those things that I mentioned previously. So it's recommended that blood pressure is monitored over a week at home. Um, a minimum of 3 days. It's taken twice a day before medications. So taken in the morning and evening before medications. Same as before, still having a 5 minute rest period before the first measurement is taken. And then making sure that the measurement is repeated. So you have sort of 2 measurements with 1 minute rest between each one. Okay, so, well, you might ask, well, why do I need to follow these steps? Why can't I just take my blood pressure and be done with it? The problem is that you need to repeat what's been done each time. So if one day you decide that you're going to be talking to a friend where you're taking your blood pressure, and then the next time you take it, you're crossing your legs, and the next time you take it, you might have your arm hanging by your side and it's not supported. Well, it's actually difficult to know what your blood pressure is because we're comparing it to different things. And that's why we have a standardized method that guidelines have spelt out that we need to follow so that we can get accurate blood pressure measurements that can be repeated by everyone. And so here are some numbers that, if you're not following the correct steps, it can affect your blood pressure by this many points. Some of these numbers, it may not seem like much, but these differences can really put you in a completely different diagnostic category. And what that means is the treatment recommended to you may be different if certain measurements are not taken accurately. And so I did want to focus on one particular aspect, and it's about, well, what if the cuff is not the correct size? So you can see here that if it's too small, or if it's too large, then it can really affect the measurement value. So if it's too small, it will overestimate what the blood pressure is, and if it's too large, it will underestimate what the blood pressure value is. So when it comes to the cuff, the size matters. Um, we can tell what cuff size we need based on the circumference of your mid upper arm, which needs to be measured. Uh, and and so we did some research to look at, well, what is the arm circumferences of the Australian adult population? And so that way, if we know what the arm circumference is, we can know, well, what cuff sizes are most suitable for Australians. And so firstly, we looked at home blood pressure devices. So when you go and buy a home blood pressure device, they often come with one cuff size. And what we found is the most common sizes that are available with the monitors are a standard cuff. So that covers about an arm circumference of 22 to 32 centimeters. And there's also the wide range cuff, which covers a larger cuff, an arm circumference size, so 22 to 42 centimeters. And so when someone buys a device to use at home or to use to take their blood pressure, you need to make sure that that cuff size is suitable for the person that we're measuring the blood pressure for. But also, the device itself needs to be validated. And what I mean by validated is that it needs to have undergone testing that meets certain strict criteria, and the device needs to have passed all those tests. And so there is a list of devices that have been validated available on a website called Stride BP. So if you're interested and curious to see if you have a home blood pressure monitor to see if it's validated, you can have a look at if it's on that list. Um, but yeah, essentially, when it comes to cuff size and home blood pressure monitors, it relies on the person knowing A, what their arm circumference is, but B, also ensuring that the monitor they have comes with the correct cuff size. And so what we found on in our research was that based on the arm circumference of the Australian population, the standard cuff, so the slightly smaller range cuff, was not suitable for about 50% of people, which is a lot. The wide range cuff was much better, but still, sort of 700,000 Australians didn't fall into even the wide range size. When we looked at high risk populations, such as those with obesity, those with diagnosed hypertension, diabetes, and high cholesterol, we saw that even less fit that standard cuff size. And there were more that actually fell outside of even the range of the wide cuff. Now, what's concerning is that three of the top 10 devices that were used by Australians at home, they come with a standard cuff, which is just too small for a lot of people. And so we really need to raise awareness on this issue and help people choose a validated device, but also one that comes with the correct cuff size. Now moving on to, well, what about the cuff sizes that are used by clinicians to measure blood pressure? So what happens at the doctor's office? Well, GPs in Australia, they most commonly use the Omron 907 device, and this device, it comes with four different cuff sizes. So medium, a small, a medium, a large, and an extra large, and it sort of covers quite a wide range. Um, and so before taking a measurement, the cuff size, it needs to match the patient's arm circumference. But it also really means that we need to have all these cuff sizes available in the doctor's room so that they can be changed based on the patients. And what we found was interesting. And so we found that when we looked at what sizes Australians would fit into, we found that most would actually require just a medium or a large cuff, meaning that, but interestingly, because it was sort of uh, uh, quite a few required medium as well as a large, it would mean that the doctors would be sort of changing the cuff every second patient almost. And that's really to make sure that we're getting accurate blood pressure measurements so that the clinical decisions that have been made are based on accurate measurements. So I covered quite a lot of ground today. At the beginning, we spoke about what blood pressure was, what high blood pressure was, and why it was important to lower it and control it. I showed you some data on the control rates in Australia, but also some specific to a particular population that is at high risk of stroke, and we still saw that blood pressure control wasn't quite where we want it. Then I spoke about sort of measuring the blood pressure and how important it is to do it properly. And then we sort of talked about the importance of choosing a correct cuff size. So before I finish up, there is a educational resource called the Blood Pressure Toolkit, which you may have seen the logo come up on some of my slides. It's essentially a resource that's been created for people that are interested within the community in understanding what blood pressure is and everything about it. And so if you're interested in more information, you can have a look at that resource. Well, that's sort of it from me. Happy to take questions. I will stop sharing.
Thank you, Ritu, for that insightful presentation. If you want to make me host again, and then I can kind of navigate through the questions for you, that'll be pretty
Yes,
easy.
sure.
On um, you can just
Sorry,
hover
just
you just hover over my name and the three dots there, and just
right, okay. And
right,
then
all
make
good.
host. There we go.
Perfect.
Great.
Thank you so much. So I think I'm host now. Perfect. All right. So thanks for that presentation. I've got one question here. Given the cuff size impacts on blood pressure, there's a risk of over or under treating for hypertension. What advice do we provide to patients in selecting the correct cuff size?
Yeah, great question. So it's mainly around knowing what your arm circumference is. And secondly, when purchasing a monitor, it's about ensuring that that home blood pressure monitor comes with the correct size for the patient. But yes, there is, I think, so based on there's some statistics where even if blood pressure on a population level is 5 mmHg difference, that can mean that we're misclassifying hypertension in about 84 million people worldwide. So it's really important that we are measuring it accurately.
Perfect. How much faith can we put in the wrist type blood pressure cuffs? I've got another one there.
Yes. So these cuffs are recommended for people where with certain arm shapes. It's usually people with extra large arms, so over 42 centimeters, an arm circumference of greater than 42 centimeters. Some guidelines recommend the use of a wrist cuff or a conical shaped upper arm device. However, there is still testing that needs to be done before we um, sorry, there's so essentially they're recommended for a certain group of
Mm.
patients. Those want the extra large arm circumferences.
I guess a question that I've got, it's kind of a leading question as well, given my work background in hypertension and arrhythmias
Yeah.
mainly. But you obviously stress the importance of hypertension, its risk factor towards whether it's atherosclerosis, arrhythmias. It's a leading risk factor and can be managed with its lifestyle medication therapies. And also obviously the importance of measuring it is important. I guess my other question is, monitoring blood pressure is key, and you made mention of cup sizes, how that's important, how that can change the results, and all these type of things. But when people are at home, so how perfect can the situation be? I mean, so is it first thing in the morning? But, the question is, how relevant is that? Because we don't sit down all day long. We are walking, we're stressed. We walk upstairs to, if we got a house up the stairs, we walk down the streets. We are moving. So by the definition of increasing our physical activity or exercise levels, our blood pressure, will increase also. So where's a good time to measure and what numbers are we kind of looking at?
Yeah, great question. So you raised a good point. So and I sort of started off with saying it can be some people sort of fixate on the numbers, but blood pressure fluctuates throughout the day. It changes depending on what we're doing throughout the day. As you mentioned, if we're exercising, it will increase. But maybe if we take a nap, it might decrease. But when we think about the when to measure the blood pressure, especially when I'm in terms of the patients conducting home blood pressure monitoring, the guidelines sort of recommend doing it in the morning before taking blood pressure medications, and then in the evening before taking blood pressure medication. So twice a day over a week, at least 3 days, and taking that into to your GP to then guide any clinical decision making that they may make from
I,
those measurements.
I think that's important to highlight.
Mhm.
I mean, and for those who are listening here, it's probably consistent what we had. But if people are recording blood pressure, it's not going to be perhaps uncommon. One day you may have a reading of 160. But if you're taking blood pressure over a course of 1, 2, 3 weeks, and you have, say, a reading a day, perhaps even two, that's, 2 times 7 is 14 readings a week. That's 28 in 2 weeks. That's, 42 readings across 3 weeks. If one or two of those are a bit high and the other 40 are relatively within normal ranges, then we can pretty much say that that's okay.
Yeah,
I think the concern is, when we start seeing 30, 40, 50% of the readings at a higher end, that's
yeah.
perhaps where we have to start to look at things a bit differently.
Yeah, and that's why it's sort of important to do it in similar conditions, take it at the
Mm,
same time of the day, before you take your medications, do it over a period of time so that we've got more of that data to make informed clinical decisions.
yeah. And look, one thing I'd like to stress, and I think let's wrap up for questions now, but um, the really important need to really address hypertension and blood pressure. I think you know, people take this lax approach, or it's a little bit high, or it's 140s, 150s. Recommendations now. I know in AF aggressive risk factor management was getting people with blood pressure under 130. I agree with that. I know the guidelines had shifted in the US, and I do agree it should be under 130, especially if you have heart disease. Um, and sometimes it may take a combination of medications to get that down. We know medications is probably the best way to drop blood pressure. Exercise and weight can help, but the best results we get with medications. So I can't stress the importance to really ensure that people are taking their meds if they are on blood pressure meds. And if they're thinking about changing them, going back to their cardiologist perhaps and working with them because there are a combination of medications that work with each other to kind of address that risk factor, which is quite key on their heart disease. So I have no more questions from our group. On behalf of Heart Support Australia, um, thank you very much for presenting with us tonight again on the Heart Support Connect series. This is recorded. We many people across our groups do watch this as a part of their peer support group sessions, and we get many consumers and healthcare professionals that also access this afterwards. And I think it's a really important session to actually highlight that. So once again, on behalf of Heart Support Australia, thank you very much.
Great. Thank you so much for having me. Have a great evening, everyone.
You too. Thank you. Bye bye.